Mr. Stunkel, what would you like to say to the community and your employees about the proposed affiliation with Atrium?
We chose a partner that is very much like us. We feel a kinship with their culture and their leadership and their people. They've shown a commitment to us and our people, and I can't wait for us to join together.
We see Floyd as being the Atrium leader in the Northwest Georgia for us, and we're intending to make obviously significant investments in this community, but also we want to bring the latest technology and equipment here. We want to address the disparities of care, and we are committed to really infusing our clinical expertise with their tremendous clinical expertise and really doing some wonderful things for the citizens here.
We have been waiting for this day, Kurt. You talked about we chose you, and you're right. You all had done such a great job and have done and are doing such a great job running your system, having high-performing talent, that we wanted to be part of that. So here we are today, and we could not be more excited.
It was over a 3-year process for us with our boards to consider what we needed to do. Given our assessment of the marketplace and the dynamics and the issues that we had facing us, after examining various organizations to join, chose Atrium Health, and it was a fantastic choice.
The health care that has been provided in Northwest Georgia has always been of a very high quality. And I see nothing but a positive enhancement of that. We've brought robotics into the hospital, which has been a win-win for the patients and our hospital system. I'm very excited about the helipad. It will allow patients to be brought to us with our Level 2 trauma center. Our medical staff office, we've had a lady that's been running it for many years, and she is unfortunately retiring. We reached out to Atrium upon hearing this news, and they have a very robust medical staff office that already provides the service to numerous Atrium facilities, and we're going to be jumping onto their platform, and we'll be totally digital. I consider it one of the aha moments for us with our Atrium merger, because we were very worried about how we were going to bring that system onto a digital platform because it takes a lot of expertise.
One of the things I think that stood out to me very early on was the sort of depth of collaboration that's at our fingertips, because Charlotte is a large legacy health system, lots of experience with community and integrating themselves with the community and providing benefits to their community. Wake Forest, of course, outstanding academic and research institution that just brings so much exciting stuff to the table. And then, of course, the Navicent system in Macon, just amazing community hospital, very similar to us in a lot of ways. And so while we're still kind of at the beginning, I think 2022 just holds endless opportunity for us in the imaging realm.
We started with the Atrium Health Supply Chain Alliance May 1st, 2020. We love interacting with their team. We all have the same ethos of what we need to do for supply chain. To take a supply chain from a national GPO and a local regional GPO and switch both those at the same time is a tremendous amount of work. We've already been able to save a tremendous amount of money on capital outlays and negotiations.
Even before we officially integrated with Atrium Health, we were allowed to join the Supply Chain Alliance, and that integration went very well, and I expected savings. However, I was just pleasantly surprised to find out we've got approximately $5 million in annualized savings with very little change to what we're purchasing.
We've really struggled in 2021 with supply chain. It's a global issue with the supply chain. And we've worked with Atrium Health Supply Chain Alliance in tandem to meet the needs during this crisis.
Very early on, we were fortunate enough to have a couple of key wins that were really related to supply chain. One was a specific supply that we've used here at Floyd for a very long time that's very important to some of the work that we do in imaging and some of the services that we're able to provide. We couldn't get that supply anymore, and so we reached out across the enterprise and very quickly were able to gain some alternative ideas around some different types of supplies that would meet the same need. Had it not been for that immediate access to expertise and alternative ideas, we probably would have experienced some delays in a critical part of the services that we provide in our MRI department.
I think the integration process is going very smoothly. One of the things that is really beneficial is just the expanded knowledge pool that we have now. And so we can take advantage of the expertise of all these different people. We were able to join their group purchasing organization, Premier. And with that, not only have we seen savings in our medications, but also access to some medications that are on short supply right now. So that's going to help with some drug shortages.
A lot of the work that we're doing right now from an integration perspective hasn't been delivered yet, but we're very excited about some of the tools and systems that this integration will bring. The ability for us to be on a unified medical record across our ambulatory as well as our acute sites, to be on a world-class ERP solution. Those are tremendous benefits and something we had a vision around, but really from a capital perspective was going to be really a challenge for us to achieve on our own. So thankfully with Atrium and the integration work, we're going to be able to bring those tools to our clinical teams as well as our administrative teams. The depth of resources and the expertise that they bring to the table, I think, is going to be a tremendous benefit for us.
We've got the things that we need for Floyd to be successful. We've got the capital commitment. We have got a foundation that's going to help us and augment the mission and the great job Floyd has already historically done in addressing community benefit issues. And now we're going to have foundation resources to add to that. But I'll also say that I'm tremendously excited about all of our colleagues that are in Atrium Health. They're all just a phone call or a Zoom or a Teams meeting away. And they are so eager to help us to lift the enterprise. Every other week it seems like we're finding a new opportunity to do something collaboratively to improve what we do here. And I don't expect that to lessen. I expect that to continue as we roll forward in making improvements in our delivery of care and our service to communities.